This conference will now be recorded.
Good evening, everybody. Welcome to our workshop tonight. We are going to be talking about caregiving and really the 4 keys to making a difference in family caregiving. And so before we get started on that, we'll just do a short dive into my company and myself. This is the disclaimer information from Cambridge, which is my broker dealer. I'm Chris Hensley. I'm a financial advisor here in Houston. My company is Houston First Financial Group, and I'm also the host of Money Matters, a radio show and podcast. We have been going at that for many, many years. And so if you recognize my voice, you might have also followed us on the podcast, www.moneymatterspodcast.com. But we are an investment firm. We specialize in retirement planning with state employees, state retirees. And so as we move forward, you're going to see this slide, retirement is a puzzle, and we talk about the system that I've developed called the retirement roadmap system. And that's the idea that retirement should not be siloed. That you'll meet a lot of financial advisors or investment firms, and they'll focus on just the investment piece or just insurance or just long-term care. And what you come to find out is that all of these things are important pieces or puzzle pieces to a full retirement. Investments are super important, but so is your TRS, so is your pension, your ORP. The topic that we're talking about, caregiving, that's another one of those. Estate planning, legacy planning, all of those seem to fall off of people's radars when it comes to doing their retirement planning or their financial planning. And let's just look at this chart here for a moment. This is about 3 different decisions, right? Long-term care, Social Security, and Medicare. And if it seems complex, it is. There's 15 different decision points here between age 58 and 86 that you have to make on these different financial topics. And when it comes to Social Security, when it comes to Medicare, these can be some of the most unforgiving mistakes that you make. If you turn your Social Security on at 70, you live another 30 years, or if you turn it on early, if you take Medicare or if you miss turning on Medicare, there's penalties that go along with that. And long-term care, a lot of time, we're going to talk a little bit about that tonight, but a lot of times people will be disappointed to find out that long-term care and Medicare aren't the same, or even your retiree health insurance. How does that work? So let's go ahead and start here. By the time we finish this talk, 327 elderly people will be treated in an emergency room for a fall. That's one fall every 11 seconds. Now, I'm sorry to say the next piece, but 3 of them will die from that one fall, one every 19 minutes. And I'm sure we can agree that those are jolting statistics, yet they come from the National Council on Aging. Many of us have dealt with elderly loved ones who have fallen. In fact, 1 in 4 elderly persons experience a fall each year. And I'm going to do just an aside on my own personal experience as a financial advisor. One of the things I really like to harp on with my clients is wills and estate planning and legacy planning. In fact, that's why we, if you go to our website, if you look at, which is HoustonFirstFinancialGroup.com, if you look at the page called Legacy Planning or HFFG Legacy Planning, we've partnered with a company out of California that can put together wills and healthcare directives and all of that. But my own personal story that I like to share is that almost a year ago in October, so almost a year out, something happened to my mom that I like to share with people. I got one of these calls that you hate to get. I was heading out of town to go camping, and I got a phone call from her human resources director, and she let me know that my mom had not reported to work since Monday. So this was on a Friday, and I was going out of town, and they wanted me to do a wellness check on her. So I immediately turned the car around. I went over to my mom's apartment. I knocked on the door. I didn't hear anything. I got the apartment to open her patio door, and what did I find? The worst thing that you could expect to find when you're doing that. I found her at the bottom of her staircase in her apartment. Now, she was rushed to the emergency room, and I was not able to visit because we were right in the middle of the first COVID outbreak. Uh, Family members weren't able to go into the hospitals to see the patients. Now, I know that she had her will done prior to this with somebody at her church, but she was in a state where she had a very high fever. We found her in sepsis, and she could not speak for herself. And so, that comes into one of the things we're going to talk about tonight is a healthcare directive and a financial power of attorney. She had her will done, but she did not have those two critical pieces of those legal documents together. And we're going to do a deep dive into why that is very important when we talk about caregiving. So let's keep going here. Now, beyond simply falling, there are other personal health and safety mishaps for the elderly that many of us have heard about or experienced. Wandering away from home, unexplained car scrapes, or even full-blown car accidents, faltering nutrition, dangerous home repairs, stoves left on freezers left open, missing or wrong medication, and neglected personal hygiene, among others. That's just a small list of unlucky accidents. Another class of items that could give rise to caregiving crisis are chronic conditions or suddenly emerging illnesses. The most common one includes diabetes, arthritis, kidney and bladder problems, dementia, Parkinson's disease, glaucoma, lung disease, cataracts, osteoporosis, breast and prostate cancer, Alzheimer's, macular degeneration, depression, and heart disease. Whenever any of these personal and health safety issues arise, inevitably they draw attention to a wide range of medical care, legal, and financial issues too. For example, some key questions include, are our loved ones' health and medical care really being monitored? Are we certain that they have all the recommended legal safeguards in place for decisions about their care and estate matters? Do we know how our loved ones plan to pay for late in life care? Is there a plan in place that actually makes some sense? Are there finances in place to pay for what's needed? What happens when the elderly family member can no longer stay in her home? So we begin to notice here just some of those issues and topics that come to light following the emergence of a caregiving challenge. Now, before we go on, I want to bring attention. It's not on this slide, but on every other slide besides this slide, you're going to find a Calendly link there, and you are entitled to a free 1-hour complimentary consultation. It's called a financial roadmap meeting. So we talk about many of the things that we are going to talk about tonight as we get further into our presentation. Now, families spanning generations often reach certain stage of equilibrium and happiness, which can go on and last for quite some time, and then something happens. Usually the oldest generation, a caregiving crisis hits, and few families know what to do.
I can't see
Stress
the thing too much.
increases as family harmony and happiness dissipates. Many of the clients are part of the classic sandwich generation. So, they're putting their kids through college, they're trying to save for retirement, and now suddenly face the new pressures and challenges taking care of one or more of their elderly parents. So I'm doing this because I've seen families devastated by the consequences of unplanned caregiving for elderly family members. Those consequences hit people on all levels: personal, professional, emotional. Sometimes families get torn apart when a caregiving challenge becomes a crisis. When this happens, it makes my job harder. When there's no planning and a crisis hits, it can have a big impact on people's financial plans across multiple generations, impacting grandchildren, adult children, and of course, our oldest loved ones. And as you'll see, these unhappy events typically raise questions about a family member's personal care and their living situation, their medical care, their personal finances, and legal issues. So there's a lot of different things tied into these. Over the course of our presentation, we want to keep in mind how these almost inevitable unhappy moments can be made less harmful and even less unhappy by planning for them. Because when no planning has been done, any single one of these questions about a loved one's affairs can become a full-blown crisis. But it's more often one in a series of events that wreak havoc. Of course, that's what we don't want to happen to you and your family. So that's why I do this presentation. And in case you're wondering, I also want to assure you that this is not a sales presentation. You will not hear anything remotely close to a sales pitch. It's not product driven. You can see what we review tonight on the agenda in the email that you received. Please note that I'm always trying to respect people's time, so I won't be taking questions during the presentation. So that's not true. If you have questions, feel free to put them into the chat bar there, and I'll try to answer them right at the end. So let's keep moving here. I think most people would agree that elder caregiving is a challenge. It's stress-inducing, and it can be very complex. Now you may ask yourself, can this challenge be effectively met? Can it be solved? And the answer is yes. The thing you need to do about it is to work with your family and associated professionals to create a caregiving plan, which addresses the personal, medical, legal, and financial matters, all wrapped up in the lives of our elderly loved ones. And that's what I'm going to walk through the remainder of the talk. Naturally, with so many issues swirling around, you may be asking yourself, what should be the first thing that we address in trying to unravel and solve these problems?
I can't.
Oh, it doesn't work?
So
Okay.
here it is. The key number one,
That's
ensure
okay.
loved ones good continued care with smart planning. What does that mean? Well, first and foremost, it means that you've got to guarantee right when a crisis hits, even as you wonder, oh no, what's happening, that the first focus is making sure that your loved ones are getting the care that they need. Gather important information about the care recipient's medical needs and conditions. There are many different questionnaires that you can use to better understand that your loved one's needs and challenges, and you're going to want to assess the biggest concerns and priorities of your loved ones. Obtain as much information as you can about the care recipient's medical needs and conditions, monitor their quality of health, and maintain communication with their care providers. All of those things are important to understand and get in place right from the beginning, right at the start. Time is of the essence. Things can change rapidly, so you also want to quickly check if the legal issues around healthcare and your loved one's estate are addressed. We'll talk more about that in a moment, but the reason time is so important is because at any moment, your loved one could lose his or her legal capacity to make healthcare and legal and financial decisions. And when that happens, a whole world of painful complexity enters your family's world. So this is an important piece of your immediate concerns. So once you've satisfied that your loved one's immediate healthcare is being addressed satisfactorily, you'll need to have a caregiving discussion with your loved one. Now, I know this is a difficult conversation. Remember to ask what's important to him or her while they're still healthy and be able to express their wishes. You must be prepared for the unexpected. Something to keep in mind is that having a discussion about money and aging with loved ones may be difficult, but it is key. It's essential that everyone have this conversation really by age 60. So I know when I deal with clients, there's generational roadblocks that are there. There's privacy issues. If you have a parent that is, not somebody who's very open about sharing these things, that is the most difficult part, is to get that conversation started, and we're going to share with you ways to approach it. You're probably wondering, apart from making sure that our loved ones' day-to-day care is being monitored, what are the other critical issues that we must address? That brings us to key 2. A caregiving plan must address medical, legal, financial, and personal issues. What exactly is a caregiving plan? So let's take a look at that for a moment. Your caregiving plan provides a framework for discussing all the what ifs that may unfold the very near or future or further out future. It outlines your care's recipient wishes, priorities, and it assesses needs in medical, legal, financial, and personal areas. And then the plan organizes all the resources that are available to your family to provide help. Okay, so let's look at the medical needs first. A good baseline in assessing your loved one's health and medical needs is to review the abilities to perform the activities of daily living. This is a standard you see when it comes to long-term care assistance, but it's also just a good diagnostic tool. Look and see, do they need help with eating or bathing or dressing or going to
Yes,
the bathroom or being
yes.
transferred from the bed to a chair? Based on your review of those activities, questions may arise about the need for in-home help. Depending on your situation, your options could include a visiting nurse, outside helpers like Senior Helping Seniors, and other organizations, or a more traditional in-home health aide, either a family member or friend or someone that the family hires. All of this can be coordinated by an elder care or geriatric care specialist, somebody who manages these issues and more for your family. Inevitably, as you start to look at this, one issue that comes up is insurance, and you want to know what is available to defray the cost of caregiving. This means a review of what your insurance policies your care recipient currently holds. There are many things to take into account for this topic, such as health insurance, retiree health insurance through their old employer, if that was available, Medicare, life insurance, and possibly long-term care insurance. For these policies, be sure to request in-force illustrations to confirm the premiums, the death benefits, the loans, and the cash values. Long-term care insurance will certainly pop up, and you may need to pay special attention to that as you review your care recipient's long-term care funding options. Long-term care is defined as needing assistance to handle some of the basic activities of daily living or requiring substantial supervision due to impairment. Now, we reviewed before what the daily activities are, and you need to decide what will happen when the care recipient is unable to handle some of those activities. Is there long-term care insurance or life insurance with a long-term care rider? This is a trend that's been, I want to say, the last 5 to 10 years in the insurance industry that we didn't see prior to that, or other approaches that can help. You'll want to look at all of this and weigh the options and seek professional advice for choosing what suits the care recipient's needs best. Now, you might not be aware that if your loved one isn't poor or on disability, their health and care insurance is likely going to be Medicare, and Medicare does not cover long-term care. A lot of people get confused by that. Only income qualified Medicaid covers it, or people who are on disability. Review all those Medicare policies because you need to understand that it's not one policy. It's actually several separate private and government programs. We've all heard of Medicare Part A and B and D and the supplements and Medicare Advantage, and it can get really get your head spinning. And on top of all of that, you need to review how the premiums are being paid and get a clear handle on when the upcoming renewal dates are, because that's critical, and you don't want to stop that coverage or have a lapse in coverage because you didn't know what was supposed to be paid. Those are the highlights of what needs to be addressed for the medical aspects of creating a caregiving plan. Now let's look at some of the legal issues there. Now again, I'm not an attorney, but we do have, if you go to HoustonFirstFinancialGroup.com and you click on the Legacy Planning tab, we do have a relationship where this is one of the things that we quarterback and act on your behalf to make sure that we implement this. But a good place to start is reviewing and updating critical documents. This includes things like the power of attorney that I mentioned earlier, healthcare agent, healthcare directive, a will, or a trust, depending on your financial situation. Of course, the financial professional and your attorney should be able to assist you with these documents. First of all, let's talk about the two that are very important, the healthcare directive and the power of attorney. They should be considered top priority. So let's take a closer look here. A care recipient can designate a healthcare agent as a surrogate or a proxy to make medical decisions if at some future time the care recipient is unable to make decisions herself. The agent can be a close relative or a friend, but should be someone known and trusted by the care recipient. In most states, the agent can make decisions anytime the care recipient loses the ability to make medical decisions, not just decisions about the end of life. The agent and the care recipient need to discuss values and qualities of life issues relating to big decisions about treatment and future medical situations. The care recipient should explain what she is asking of the agent and talk about why she picked him or her. The healthcare agent needs to know about the quality of life that is important to the care recipient and what medical treatment she would want in certain situations. These discussions are important because situations could occur that the care recipient can't anticipate, and the agent may need to base a decision on what she knows about the care recipient's values and her views, what makes life worth living. These are not simple questions, and people's views may change. So the care recipient should talk with the agent in depth repeatedly over time. For similar reasons, a legal proxy is also needed. Be sure that your plans also address the power of attorney issue. There are two types of power of attorney. There's a durable power of attorney, an agent who's authorized to act immediately on the creation of the power of attorney. And then there's something called a springing power of attorney, in which the agent is authorized to act upon the care recipient's behalf only when specific criteria for legal incapacitation is met. As I mentioned earlier, many people are surprised to learn that Medicare does not cover long-term care. Only Medicaid does that for those people who are income qualified. The cost of long-term care can deplete your loved one's finances if they've not planned for it. There are ways to achieve coverage through Medicaid asset protection, but these rules are very stringent and complex. You'll need financial and legal advice if you want to explore this approach. Another important issue, a legal issue to address is the estate plan. Find out if the care recipient has a will and an estate plan. Do the documents need to be updated? When a will isn't sufficient, you might also look at a trust and what your other options are. Those are the key legal issues you'll want to review in your caregiving plan. Now let's take a look at the financial side of it. Take a detailed look at your loved one's finances. Look at what their tax situation is, as well as their sources of income, reoccurring expenses, and assets and liabilities. Also, you'll want to know the financial professionals in their lives. Who have they been providing advice for them and services over the recent years or the most recent years? Let's dive into some of the detail here. When you're reviewing income and expenses, identify all the sources of income. Are there any pensions? What about the IRAs and what's going on with regarding minimum distributions? Is there an annuity in place or more than one annuity? Is there life insurance and what's the situation with that? What about investments? Is there rental income, savings, checking accounts as well? Whatever sources of income there are, you need to go through all of them. On the flip side, expenses to consider include: how is housing being paid for? How is transportation being paid for? What are the regular healthcare expenses? What's being spent each month for food and entertainment? And of course, drugs and medical care are important issues on the expense side. You'll also need to look at it from a perspective of assets and liabilities. What's the situation? Do they have a home? And is it paid for? Is there a mortgage or even a second mortgage? Do they have a second home? And if so, what's the status with that? Do they have a rental property? What's the situation with the cash reserve, money market, CDs? Is there any land, bonds, stocks, etc.? Create a list of all of these assets that they have, some of which produce income and some of those which don't. And then on the liability side, list the mortgages and the credit lines and the credit card debt and the property taxes and all of the things like that. Another piece of the puzzle is taking a look at current investments and their savings. Identify all the savings and investment accounts that are held by the care recipient and your family. What is the asset allocation of those investments? Is it appropriate for their current situation or the problem that you're trying to solve? Does the asset allocation really match the care recipient's risk profile at this point in time? Again, a financial professional can answer questions for you and create strategies for investments if they're not already in place. It's also critical that you review the titling and beneficiaries on all of those accounts. You've got to confirm that this is done correctly. This is the worst time to find out that your accounts weren't styled the way that you want them to be. It's painful when somebody passes away and it turns out the beneficiary on a big account is someone the loved one didn't want to receive it, but no one had looked at the account in years. You want to confirm that the beneficiaries and contingent beneficiaries are all these accounts are in place and that they're up to date and that they reflect the care's recipient desires and needs. You need to do this not just for investments, but also for insurance, annuities, and really everything else. Because again, mistakes are found too late and they can be painful and embarrassing, and you just don't want that to happen. Naturally, as part of your review, you're going to want to identify financial professionals involved in your loved one's lives. Who is the accountant or the CPA? Who's the insurance agent? Do they have an estate attorney? Do they have a financial professional? Is there a bank rep that's involved? And any other professionals that come to mind. This is the time to discuss that. It's also important to review their tax situation. Understand how taxes are being paid on the income that they're receiving, on if they have property, who's filing them quarterly or annually, if there's in-home help that your loved one is paying for or you're getting ready to pay for, and the property taxes being withheld, or is it outsourced to a company? If it's somebody that you're paying directly, you need to figure out the tax issues. Likewise, you'll also want to inquire about elderly employer tax benefits. In fact, you are hiring somebody to come in as caregiver. There are medical care and dependent care deductions and that sort of thing. Like I've said, this is an area where it's important to seek professional help. Your financial professional and your accountant may be extremely helpful in situations like this. If it's somebody that does charitable donations, or if they have a AGI that a high AGI, it cannot exceed 50% of your adjusted gross income, but they're doing donations. These are all things that you need to know up front. Gifts of appreciated property, that sort of thing. You need to identify those. Once you've completed a survey of your loved one's finances, then as a part of the caregiving plan, you need to create a financial plan and a monthly budget. Understand your care recipient's monthly cash flow. Where is all the money coming from and where is it going out? You also need to ensure that all the bills are being paid on time. Who's going to be doing this? It is important to continually monitor spending and bank accounts because oftentimes money starts disappearing, going out the door for a variety of reasons. Sometimes dementia is undiagnosed, or somebody is caught up late at night buying a gazillion things from QVC, or sometimes a less than savory situation of financial exploitation is going on. You want to be able to monitor what is happening. Now that covers the financial piece to some degree, but you'll also need to address the personal side of things. And before we dive into that, I'm going to remind everybody that there is a complimentary consultation. The link that's on the bottom is a Calendly link to my calendar. And so if that is something you want to take advantage of, if you go to my calendar, you're going to find the link for virtual financial roadmap meeting. And that's something that you can do. Look closely at the personal needs of your loved one and what living options appeal to them. All right, everybody wants to stay in their home as long as they possibly can, but when the end of the road comes and something else has to happen, what are the other options? Is it moving in with a family member, or is it moving to a retirement facility, or some sort of assisted living, or another option? Make sure that your loved one is taking advantage of all the benefits that they qualify for. Many families aren't aware of the benefits that are available. ARP is a good resource that can help you determine if your loved one does qualify for some additional benefits. Your loved one may also want to write a letter of instruction that goes beyond the will or any sort of legal document. This is a letter that serves as a reminder to the family of the sentiment behind your loved one's wishes. It has no legal authority, but it's like a final message for a loved one. It's intended to be the latest, most up-to-date version of what they want to say and what's important to them, conveying those values that we were discussing before. The letter of instruction may also address charities they like, as in, please, I love the library, and make sure the library gets some money. Or maybe they're tangible assets, like the autograph from Bruce Springsteen that's been on the wall for all these years. Who's really going to get it? There are other things, usually more mundane, but very important things, such as usernames and passwords and final arrangement wishes. Sometimes people say, be sure that the bagpipes are playing when they bring me down the church steps. Animal care is another thing that's usually important to people. And sometimes people want to write their obituary or write, in my obituary, say that I played third base for the coal mining team when I was 19 years old and just starting out life, all that kind of stuff. This may not be everybody's cup of tea, but you want to be sure that you give your loved one the opportunity to deliver a letter of instruction that will be part of their final affairs. And in our legacy planning section for clients, we have some templates and some workbooks and some things that we can help facilitate that conversation with a loved one. One other important thing to address on the personal front is to make sure that all of these documents that we mention are complete and are up to date. Then you want to make sure that they're all in one safe place, because you want to access to them when the time comes. And since you want them all in one spot and you want that spot to be secure, you might consider using a digital vault that will store electronically and securely all these important documents. Now, we do have, for our clients, we've got in our client portal, we've got a digital vault. I like to call it Dropbox for financial stuff. So, but one good way to share legal documents is, say, for instance, if you have a will and you don't want to give a 50-page document to the executor, you can give them a link to whoever you feel comfortable sharing that with. That's an example of using a vault for digital filing and that sort of thing. Okay, so let's get through the technical heavy stuff here for now, but many of you are probably thinking to yourself something like, wow, all right, but what about the stress and the strain that it puts on the rest of the family, especially me? That brings us to our key insight number 3. Caregiving always impacts the rest of the family in a big way. And that really needs planning too. It needs to be addressed. It can't just be the unspoken elephant in the room. Let's take a look at some of the statistics. Becoming a caregiver is a likely occurrence for almost everyone. The latest ARP survey says that there are 34.2 million elder caregivers in the US. That number is expected to grow as the population ages, and 75% of all caregivers are female, with an average age of 46, according to the Institute on Aging. Deciding to become a caregiver is a huge decision, and sometimes it occurs suddenly when something unexpected happens to your loved one. But remember, you're not alone, and it's important that you recognize that the caregiving plan really must address the caregiver's needs too. Because when this stuff hits, it's challenging. There are demands on your personal and your professional life. There may be a loss of income plus additional expenses, and stress at home, and disharmony within the family, and almost inevitably burnout and other emotional effects hit. This issue needs to be addressed right from the beginning. As I said, it's not an easy task, but caregivers often get very caught up in delivering care to their loved ones and feel that it's something that they have to do. But it can cause them to forget about their own needs, wants, and wishes as well. Here we see the sad truth that caregivers are susceptible to depression and anxiety. 23% of caregivers have moderate to severe depression, and 33% have moderate to severe anxiety. So caregivers need to take care of themselves too and be supported by the entire family. Some of you listening to this tonight are caregivers, and hopefully you know to stay on top of your health, to address your basic needs by getting rest and exercise. Don't be afraid to ask for help. Look to join support groups. They are out there and we can help you find them if you need assistance. Caregivers and families may want to take advantage of services specifically aimed at their situation. This could be something like getting a geriatric care or elder care manager involved. There are visiting nurses, in-home aides, adult daycare, and a variety of other services. It's important that you're aware of these services so that you can consider working them into your caregiving plan whenever possible. There are also organizations and services to help the caregiver. There are people who can organize healthcare information for your family and negotiate bill payments, others who can locate and hire nurses and therapists or schedule and attend doctor's appointments, and others who run errands, cook, or offer companionship. Additional talking points include contacting local area agencies to finding out more about resources available for elder care. Visit www.eldercare.gov. Attend local support groups for caregivers can help manage your feelings and provide a sense of community and understanding. There's also help available in the form of technology. Most well-known or personal emergency responses services like Life Alert or Great Call, where the care recipient wears a device where they can press a button and get help right away. These have really advanced in abilities and stylishness over the past several years, so I recommend that you look into them even if your mom would never wear it. There are also medication reminders, medication being a critical piece of well-being. You probably already know of Skype and FaceTime and other services that will let you check in and say hello. Finally, many websites and apps offer a digital vault to store medical information like your list of doctors and prescriptions and other things like that. Many technologies exist and they do relieve some of the burden of caregiving. For some of you, the help that we've discussed will enable you to preserve your job, and this is a great thing. Keep working if it's possible, though, of course, sometimes it's not. If you're employed, inquire about benefits such as Family Leave Act. The key piece is that you maintain communication with your employer about what's going on. So now you may be saying to yourself, we don't have expertise in all these areas. How can we possibly start to address these complex issues, not to mention afford it? That brings us to key point number 4, which is we need a team approach to produce the best caregiving plan. This is everything in your loved one's lives coming together at the end. It's a lot of different things from a lot of different disciplines all coming together. It's easy to feel overwhelmed, and putting together the pieces of the puzzle can be difficult and time consuming. The most important thing that you don't take on the caregiving challenge alone, because you can't really. It's important to work with others in your family. As you build a team of people who can assist you and create this plan, you need to include other family members, the care recipient, him or herself, and anybody else who provides emotional support. It's a difficult time of life, and these are difficult issues, but nonetheless, they have to be addressed. You definitely want to seek professional advice when developing your caregiving plan. Your team at varying times will draw from people in various fields who are trained and experienced with addressing these complex issues. That will likely include financial professionals such as myself, an estate attorney, other attorneys, insurance experts, CPAs, geriatric care managers, and so on. We're getting close to finishing, so let's review. You know the 4 key challenges. It's complicated. It's a complicated stage of life for your loved one and for you and the rest of the family. Not planning will increase the challenge and problems. The key issues that need addressing, we've run through them, are medical, legal, financial, and personal. And you know, it really does require a team approach to succeed. Some of the things may be running around in your mind at this point because they're common reactions when people sit down and look at all of these issues. I have never done this before and it's very complicated. Yep, that's one. The stakes are too high here to ignore the issues mom or dad's health, wealth, and well-being need to be attended to. I don't have enough experience in healthcare for the elderly to manage these issues. We're going to need help understanding the financial issues or legal issues involved here. These are all natural, so don't be concerned. If it seems complicated, it can be solved. So let's talk about getting started with a caregiving plan. I think that you can see now that this stage of life is extremely complicated, and not planning ahead will bring an array of difficult and painful experiences for the whole family. We know that it's imperative to do all that we can to guarantee continued good care for our loved ones. Some of them will have a long, slow, and relatively safe decline, while others will go through quick, shocking episodes of illness and deterioration. We've got to have in place the best, most workable plan. We know that often one family member has the burden of overseeing it, not actually delivering much of the care. This situation can have a dramatic impact on their personal and professional lives. Their role needs to be acknowledged and supported, and good caregiving planning can help reduce their stress and improve their overall situation. I briefly introduced you to some of the major topics involved in caregiving and planning so that painful, costly outcomes for the entire family are to be avoided. When it comes to personal issues, we're here to figure out how our loved ones can stay in their home as long as possible, and then have a plan for when it isn't possible any longer. For medical issues, we need to understand our loved ones' wishes and how their decisions are made and communicated, especially when they can no longer confidently speak for themselves. For legal issues, it means putting into place and updating a range of legal documents related to our loved one's estate and their legacy so that their wishes are followed, including an easy and efficient transfer of their assets at the proper time. And financial issues. Financial planning is needed so that our loved one's finances can be best organized to pay for their safe care as long as needed. As I've said, these personal, medical, legal, and financial planning issues will require the participation of professionals on your team from time to time. And those professionals can guide a family to varying degrees. All of what I've just recapped here must be covered in the creation of a caregiving plan. It's the one comprehensive way that everyone involved, all generations, can be assured that care for their loved ones will be handled well. So we're right here at the end. We do offer the 1 hour complimentary consultation. The link's there at the bottom. And if you have any questions, you could feel free to go ahead and put them in the chat bar. I was wanting to we started there at 6 and I wanted to get everybody done by 7 because it's dinner time. So let me see if we have any questions. And I don't see anything in the question bar. So with that, thanks everybody for joining tonight and have a good evening.
It's over?
Yeah.
He didn't talk at all about the legacy he only talked about the elderly and how you're handling
That's all he was